oral thrush, that is also called oral candidiasis. It's a condition in which the fungus Candida albicans accumulates on the lining of your mouth. Candida is a normal organism in your mouth, but sometimes it can overgrow and cause symptoms. Oral thrush causes creamy white lesions, usually on your tongue or inner cheeks. Sometimes oral thrush may spread to the roof of your mouth, your gums or tonsils, or the back of your throat. Although oral thrush can affect anyone, it is more likely to occur in babies and older adults because they have reduced immunity. And other people with suppressed immune system or certain health conditions or people who take certain medications. Oral thrush is a minor problem if you are healthy, but if you have a weakened immune system, symptoms may be more severe and difficult to control. Earlier on this channel, I already uploaded a video that was a short video about oral thrush, and today I am going to discuss this illness in detail. First of all, let me tell you the symptoms. Well, in children and adults, initially you may not even notice symptoms of oral thrush. Signs and symptoms may include creamy white lesions on your tongue, inner cheeks, and sometimes on the roof of your mouth, gums, and tonsils. Slightly raised lesions with a cottage cheese-like appearance, redness, burning, or soreness that may be severe enough to cause difficulty eating or swallowing. Slight bleeding if the lesions are rubbed or scraped, cracking and redness of the corners of your mouth, a cottony feeling in your mouth, loss of taste, redness, irritation, and pain under dentures, that is denture stomatitis. In severe cases, usually related to cancer or weakened immune system from HIV/AIDS, the lesions may spread downward into your esophagus, which is the long muscular tube stretching from the back of your mouth to your stomach, and that condition is known as Candida esophagitis. If this occurs, you may experience difficulty swallowing and pain or feel as if food is getting stuck in your throat. In infants and breastfeeding mothers, in addition to the distinctive white mouth lesions, infants may have trouble feeding or be fussy and irritable. They can pass the infection to their mothers during breastfeeding. The infection may then pass back and forth between the mother's breast and the baby's mouth. Women whose breasts are infected with Candida may experience signs and symptoms such as unusually red, sensitive, cracked or itchy nipples, shiny or flaky skin on the darker circular area around the nipples, that is areola, unusual pain during nursing or painful nipples between feedings, stabbing pain and deep within the breast. If you or your child develops white lesion inside the mouth, you should see your doctor or dentist. Thrush is uncommon in healthy, older children, teenagers, and adults. So if thrush develops, you should see your doctor to determine if further evaluation is needed to check for an underlying medical condition or other cause. Now let me tell you the causes. Normally your immune system works to repel harmful invading organisms such as viruses, bacteria, and fungi, while maintaining a balance between good and bad microbes that normally inhabit your body. But sometimes these protective mechanisms fail, increasing the number of Candida fungus and allowing an oral thrush infection to take hold. The most common type of Candida fungus is Candida albicans. Several factors such as weakened immune system can increase your risk of oral thrush. Now I'll tell you the risk factors. You may have increased risk of oral thrush infection if there are situations like weakened immunity. Oral thrush is more likely to occur in infants and older adults due to reduced immunity. Some medical conditions and treatments can suppress your immune system, such as cancer and its treatment, organ transplantation, and require drugs that suppress the immune system, and HIV or AIDS. Diabetes. If you have untreated diabetes or the disease is not well controlled, your saliva may contain large amounts of sugar, which encourages the growth of Candida. Vaginal yeast infections. Vaginal yeast infections are caused by the same fungus that causes oral thrush. You can pass the infection to your baby. Medications. Drugs such as prednisolone, inhaled corticosteroids, or antibiotics that disturb the natural balance of microorganisms in your body can increase your risk of oral thrush. Other oral conditions such as wearing dentures, especially upper dentures, or having conditions that cause dry mouth can increase the risk of oral thrush. Now I'll tell you the complications. Oral thrush is seldom a problem for healthy children and adults. For people with lowered immunity, such as from cancer treatment or HIV/AIDS, thrush can be more serious. Untreated oral thrush can lead to more serious systemic Candida infection. If you have a weakened immune system, thrush may spread to your esophagus or other parts of your body. Now I'll tell you preventive measures. And the measures which I'm going to tell you may help reduce your risk of developing Candida infections. First of all, you should rinse your mouth. If you need to use a corticosteroid inhaler, be sure to rinse your mouth with water or brush your teeth after taking your medication. Brush your teeth at least twice a day and floss daily or as often as your dentist recommends. You should check your dentures. Remove your dentures at night. Make sure dentures fit properly and do not cause irritation. Clean your denture daily. Ask your dentist for the best way to clean your type of dentures. You should see your dentist regularly, especially if you have diabetes or weird dentures. Ask your dentist how often you need to be seen. Watch what you eat. Try limiting the amount of sugar-containing foods you eat. These may encourage the growth of Candida. Maintain good blood sugar control if you have diabetes. Well-controlled blood sugar can reduce the amount of sugar in your saliva, discouraging the growth of Candida. You should treat a vaginal yeast infection as soon as possible. Also treat dry mouth. Ask your doctor about ways to avoid or treat your dry mouth. Now I will tell you the diagnosis. Well, diagnosis of thrush depends on the location and identifying whether there is an underlying cause. When patients come to us and if we see that thrush is limited to your mouth, then we may examine your mouth to look at the lesions. Take a small scraping of the lesions to examine under a microscope. If needed, we do a physical exam and certain blood tests to identify any possible underlying medical condition that may be the cause of oral thrush. If thrush is in your esophagus, to help diagnose thrush in your esophagus, your doctor may recommend any of the tests which I am going to tell you. First of all, we can carry out biopsy. The tissue sample is cultured on a special medium to help determine which bacteria or fungi, if any, are causing your symptoms. Endoscopic exam. In this procedure, your doctor examines your esophagus, stomach, and upper part of the small intestine, that is known as duodenum, using a lighted flexible tube with camera on the tip, that is endoscope. Physical exam. If needed, a physical exam and certain blood tests may be done to try to identify any possible underlying medical condition that could cause thrush in the esophagus. Now I'll tell you the treatment. The goal of any oral thrush treatment is to stop the rapid spread of fungus, but the best approach may depend on your age, your overall health, and the cause of the infection. Eliminating underlying causes when possible can prevent recurrence. In healthy adults and children, your doctor may recommend antifungal medication. This comes in several forms, including lozenges, tablets, or liquid that you swish in your mouth and then swallow. If these topical medications are not effective, medication may be given that works throughout your body. For treating infants and nursing mother, if you are breastfeeding and your infant has oral thrush, you and your baby could pass the infection back and forth. Your doctor may prescribe a mild antifungal medication for your baby and an antifungal cream for your breasts. In adults with a weakened immune system, most often your doctor will recommend antifungal medication. Thrush may return even after it has been treated if the underlying cause, such as poorly disinfected dentures or inhaled steroid use, is not addressed. Now I'll tell you some lifestyle and home remedies. The suggestion which I'm going to tell you may help during an outbreak of oral thrush. You should practice good oral hygiene. Brush and floss regularly. Replace your toothbrush often until your infection clears up. Do not share toothbrushes. You should disinfect your dentures. Ask your dentist for the best way to disinfect your dentures to avoid reinfection. Also, you can try warm salt water rinses. Dissolve about half teaspoon, that is 2.5 milliliter of salt in 1 cup of warm water. Swish the rinse and then spit it out, but do not swallow. Also, you can use nursing pads in case of breast fungal infection. If you are breastfeeding and develop a fungal infection, use pads to help prevent the fungus from spreading to your clothes. Look for pads that do not have plastic barriers, which can encourage the growth of Candida. Wear a clean bra every day. You should ask your doctor about the best way to clean your breast nipples, bottle nipples, pacifiers, and any detachable parts of a breast pump if you use one. Okay, so this was my video about oral thrush. In fact, I have already also covered breast thrush in this video also. If you have any questions about oral thrush or any other illness, if you for which you can't find the video on this channel, then please ask those questions in the comment section, and I'll try to reply to you as soon as possible. Thanks for watching this video. See you in next video. Bye for now.